there, my name's Emily and I'll be your nurse today. Can you go ahead and tell me your name and date of birth?
Chandler Altenberg, February 8th, 1995.
Alright, this is the correct patient. I'm going to be doing a cardiovascular assessment on you today. It should take less than 20 minutes. If you have any questions, concerns, just let me know. And if anything hurts or you feel uncomfortable, please let me know.
Okay.
Alright, patient understands the purpose of this exam. Okay, can you go ahead and put on this gown for me and empty your bladder? The ties go in the back.
Perfect.
Thank you so much. Alright, is the temperature comfortable in this room? Do you feel okay with the privacy?
Yeah.
Alright, patient is comfortable with surroundings. I'm going to ask you some questions. If you wouldn't mind answering, that would be wonderful. So can you go ahead and tell me if you've experienced any chest pain, shortness of breath, or palpitations?
No, none of those.
Great. Do you have a history of hypertension, diabetes, or kidney disease?
No.
Do you have a family history of hypertension, diabetes, or cardiovascular disease? Alright, and let's see, have you noticed any swelling, pain, or any new visible veins in your legs, any changes of your skin?
No.
All right. And if patient had reported any problems, I would do old Cart's ice to assess the extent of her problems. All right, so I'm going to go ahead and check some pulses on you, make sure your blood flow is all right. So first I'm going to check your temporal. All right, temporal pulses are equal bilaterally and +2 with no thrills. I'm going to do your left carotid. +2 with no thrills. Your right carotid. +2 with no thrills. Patient is awake, alert, sitting upright, has no trouble breathing, looks comfortable. All right, and then let's see, I'm going to go ahead and check your arms, which look symmetrical and proportionate to the body. I'm going to check the temperature. Feels warm, skin is pink, there's no edema noted. Skin turgor is elastic. I'm going to look at your hands. Cap refill is less than 3 seconds. Nail beds are pink and 160 degrees. I'm going to flip you over and feel your radial pulses. Radial pulses are +2 and equal bilaterally. I'll feel for your brachial pulses. Also +2 and equal bilaterally. And look at your legs. They're symmetrical, proportionate to the body. And feel. Okay. Temperature is warm. Skin is pink and appropriate for ethnicity. We have cap refill, which is less than 3 seconds, and nail angle is normal. Are you experiencing any tenderness, any pain? Okay, perfect. Skin turgor is elastic, so I'm going to feel for your dorsalis pedis pulses now. Those are +2 and equal bilaterally. Feel for your posterior tibialis pulses. +2 and equal bilaterally. I'm going to straighten out your legs a little bit and feel for the popliteal. Popliteal pulses are +2 and equal bilaterally. I'm going to take a look at your chest. It looks symmetrical with no abnormal pulsations or lacerations or any trouble with her skin. And then I'm going to feel for your apical pulse, which is the 5th intercostal space, mid-clavicular line. All right, so now I'm going to give that a listen. Apical pulse is regular, and I would listen for a full minute. It's about 72. And I'm going to go ahead and auscultate your carotid to listen for any bruits using the bell of my stethoscope. No bruits in the left carotid. If you could take a deep breath and hold it for me. No bruits in the right carotid. I'm going to listen to the 5 points of your heart with both the diaphragm and bell of my stethoscope. You can just breathe normally and relax. All right, so let's start. Aortic. pulmonic, Erb's point, tricuspid, and then mitral. So at the aortic and the pulmonic, the S2 was louder than S1. At Erb's point, S1 and S2 were equal. And at the tricuspid and mitral, S1 was louder than S2. So, and I didn't hear any murmurs, but I'm going to listen again with the bell. So again, at the aortic and the pulmonic, S2 was louder than S1 with no murmurs. Erb's point, S1 and S2 were equal. And then at the tricuspid and mitral, S1 was louder than S2, no murmurs, and no S3 or S4. I'm going to go ahead and measure your calf just to make sure that there is no edema and that everything's normal and symmetrical. All right, you're all set. Thank you so much.
Thank you.